All right, welcome back. We're diving into our final explainer on developmental anomalies of the oral cavity. And this time, we're focusing on the soft tissues. And what's so fascinating is that it all really boils down to this one big idea. Our face is like an incredibly intricate puzzle, one that gets assembled piece by piece in the very first weeks of our lives.
Okay, take a look at this. I know it might not look like any face you recognize, but this is exactly where it all starts. Around the 4th week of development, our face isn't this one solid thing. Nope, it's actually a collection of separate parts, puzzle pieces really, that have to move, grow, and fuse together with just absolute precision. If there's any little hiccup in this super delicate process, well, that can lead to some of the anomalies we're about to get into.
And that brings us right to our first, and probably most well-known group of anomalies, orofacial clefts. I mean, this is the classic example of what happens when those developmental puzzle pieces just don't quite connect on schedule. You know, the timing here is absolutely everything. There's this super critical window for all this fusion to happen. By the 6th week, the upper lip, it should be totally formed. Then, just a couple weeks later, by the 8th week, the two shells that make up the roof of your mouth, the palate, they have to fuse together. It's an incredibly fast and complex dance.
And right here, we can actually see that process in action. So on the left, you've got these two palatal shelves. They start out hanging down vertically, one on each side of the tongue. But as the jaw grows, the tongue drops down, and that lets the shelves swing up horizontally and fuse right in the middle, almost like closing a drawbridge, right? But on the right, you can see what happens when that fusion fails. It leaves that gap, or what we call a cleft, in the palate.
So what's really interesting here is how these conditions actually show up. It's not always just one or the other. In fact, the most common scenario, making up 45% of cases, is a combination of both a cleft lip and a cleft palate. An isolated cleft lip, that accounts for about 30%, and a cleft palate all by itself is actually the least common of the three.
You know, clefting is one of the most common major congenital defects in humans. But what's wild is how much the prevalence varies across different populations. We see it in about 1 in every 1,000 births among whites, but that rate jumps up to 1.5 times higher in Asians. And then the prevalence is lowest among blacks at about 0.4 per 1,000 births.
And the severity? Wow, it can vary dramatically. It's not always this wide, obvious gap. I mean, look here. This is called a bifid uvula. That's where just that little dangly thing at the back of your throat is split. This is actually the most minimal form of a cleft palate. It just goes to show you how wide the spectrum for this condition really is.
And this is exactly why treatment isn't some simple one-time fix. It takes a whole team of specialists. We're talking pediatricians, surgeons, dentists, speech therapists, you name it. They all have to work together through multiple procedures over the entire course of a child's development. It's a really long and complex journey.
Okay, so that same principle of precise fusion, it applies to another absolutely critical structure, the tongue. It also has a really complex origin story. It doesn't form as just one single muscle, but from the merging of several different parts.
You can see here how these different swellings from the mandibular arches start to grow and then merge together. It's another set of puzzle pieces that have to fit just perfectly for the tongue to have its normal size, shape, and function. And when they don't, well, that's when we see a whole range of anomalies.
And here, wow, you can really see the two extremes of what can happen. On the left, we've got microglossia, that's an abnormally small tongue, and on the right, macroglossia, a super enlarged tongue. Both of these can cause pretty significant issues with breathing, eating, and speech, which just goes to show how critical that proper development is for function.
All right, now here's a much more common condition you might have actually heard of, Ankyloglossia, or as most people call it, tongue tie. This is where that lingual frenum, you know, that little cord of tissue connecting the underside of your tongue to the floor of your mouth, is unusually short and thick, and it restricts movement. And what's interesting is it's about 4 times more common in boys than in girls. You can really see the effect here. Just notice how that tight band of tissue is physically tethering the tongue, limiting how much it can move. Now, a lot of people can compensate for minor cases, but in the more severe instances, it can cause real difficulties with feeding when you're an infant and can lead to speech defects later on. Okay, and then there's this. This is called hairy tongue. And yeah, I know, it looks alarming, but it's actually a benign condition. What you're looking at is a major buildup of keratin, that's the same tough protein that makes up our hair and nails, on those little bumps on the tongue, the filiform papillae. This can be linked to a bunch of different factors, but heavy smoking is a really common one.
All right, to wrap things up, let's zoom in on a few other fascinating details you can find in the lips, the linings of the mouth, and the gums.
The variations here can be just as surprising.
So first up, we have the double lip. This is a pretty infrequent anomaly, where a redundant extra fold of tissue forms on the inside of the lip, and it's usually the upper one. It's basically caused by having a little too much tissue and mucus glands during development.
And as you can see right here, it's not always obvious. That is, until the person smiles or talks. That's when this extra fold becomes visible, and it creates the appearance of a second lip just sitting behind the first.
80%. Just let that number sink in for a second. 80%. What could possibly be present in the mouths of a whopping 80% of the population?
Well, it turns out, if you've ever looked really closely in the mirror and seen tiny little yellowish spots on the inside of your lips or cheeks, you're looking right at them. They're called Fordyce granules, and they're simply oil glands that are in an unusual spot. And because they're so incredibly common, they're just considered a completely normal variation, not a disease at all.
And this brings up such an important point. You know, the word anomaly can sound kind of scary, but all it really means is something that's just different from the common form. So on one end of the spectrum, you have something like a cleft palate, which requires a lifetime of medical care from a whole team. And then on the complete other end, you have Fordyce granules, which need absolutely no treatment at all.
Here's one last fascinating example for you. Hereditary gingival fibromatosis. This is a rare genetic condition where the gums, or the gingiva, just overgrow. You can see this dense, firm tissue that in some cases can grow so much that it completely covers the teeth. It's just a powerful reminder that our genetic and developmental blueprints have instructions for literally everything, right down to how dense our gums should be.
So it's pretty clear, right? From major structural challenges all the way down to harmless little quirks, these so-called anomalies are really just variations in our incredibly complex developmental code. They aren't mistakes, they're just variations. Which leaves us with a pretty fascinating question to think about. In a system that's built for so much variation, what does the word normal truly even mean?